Let's look at the cervical vertebrae. Here we have the atlas, C1. Then interesting about the atlas is that it has no vertebral body. Here we have the superior view and the inferior view. We can see the posterior arch with the posterior tubercle and the anterior arch with the anterior tubercle. We can also see the groove for the vertebral artery. Here, we have the transverse process with the foramina of transverse process. Visible here, we have the facet for dens. Here we have the lateral mass. On the lateral mass, we have the superior articular surface, which is kidney-shaped. And here, we have the tubercle of for transverse ligament of atlas. Inferiorly, we have the inferior articular surface, which is round and flat. Here we have the axis. It is the C2 vertebrae. We have the superior view, inferior view, the posterior view, and the anterior view. Here we can see the spinous process, the vertebral arch, and the vertebral body. Here, we can see the superior articular surface. We have the transverse process with the foramina of transverse process. Here, we can see the dens. The dens has the apex. It has the posterior articular surface and the anterior articular surface. Inferiorly, we can see the inferior articular process with the inferior articular surface. We can also see, visible here, the inferior vertebral notch. Here we have the typical cervical vertebrae. It has the bifid spinous process. It has the lamina of vertebral arch and the pedicle of vertebral arch. It also has the superior vertebral notch and inferior vertebral notch. Here, we can see the superior articular process with the superior articular surface and the inferior articular process with the inferior articular surface. Visible here is the transverse process with the foramina of transverse process. We have the posterior tubercle and the anterior tubercle. On the C6 vertebrae, the anterior tubercle is known as the carotid tubercle. In between, we have the groove for the spinal nerve. Here we have the vertebral body and the uncus. In this vertebrae, we have an anomaly. The transverse process, visible here, and the foramina of transverse process is divided into two by a bony fragment. Here we have the typical thoracic vertebrae. It is located at the level of T2 through T9. It has some characteristic features. For example, it has the costal facets, visible here, and the costal facet of the transverse process, visible here. The vertebral body is heart-shaped, and the spinous process is long and directed inferiorly. The vertebral foramen is round. Here we have the superior view, the inferior view, the posterior view, and the anterior view. Anteriorly, we can see the vertebral body. We can also see the superior costal facet and the inferior costal facet. We can also see the superior vertebral notch and the inferior vertebral notch. We can also see the pedicle of vertebral arch and the lamina of vertebral arch. And once again, the spinous process. Here, this is the transverse process, and on the thoracic vertebrae, it is known as the costal process. We can see the costal facet of transverse process. On the superior articular process, we have the posterior articular surface. And on the inferior articular process, we can see the anterior articular surface. Here we can see the vertebral foramen. Let's look at the lumbar vertebrae. The interesting about the lumbar vertebrae is that the vertebral body is kidney-shaped. The spinous process is thick and directed sagittally. The typical lumbar vertebrae also has two additional processes, the mammillary process and the accessory process. Here's the superior side of the vertebrae, the inferior side. Here we have the posterior and the anterior. So once again, posteriorly, we can see the spinous process. We can also see the lamina of vertebral arch, as well as the pedicle visible here. Here, we have the superior articular process with the medial articular surface and the additional mammillary process. We also have the transverse process with the additional accessory process. Visible here, we have the inferior articular process with the lateral articular surface. We also have the inferior vertebral notch and the superior vertebral notch. Here we have the vertebral foramen, which is triangular shaped, as well as the vertebral body.